Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. Welcome to Startup Health Now. My name is Unity Stoakes, co-founder of Startup Health. I'm really excited today because I get a check-in call with an extraordinary CEO, an extraordinary founder, health transformer in the Startup Health community, Avanlee Christine. Avanlee from Avanlee Care is just a really amazing person. I'll never forget the first time I met her at America's first KOA, which is kind of an RV campground. If you've ever been to a KOA, or if you ever haven't, you really should do it. This was in Montana a couple of years ago. I was with my family, and she came to visit with us because she was also in Montana. And we met at the KOA, and she brought her brand new little baby at the time, Adam. So we're going to have a great conversation. We're going to learn all about the amazing progress that Avanlee Care has made with their product, and most importantly, the inroads they've made really now with the different health plans who are signing on and partnering with Avanlee Care. So we're going to dig into lessons learned and all the progress that they're making, and learn about some of the wisdom from going through the valley of death early on and all the challenges of getting started, to then really focusing on your customers, focusing on your product, and how that can really accelerate your progress, and how she really at year 5 has hit an extraordinary stride. And we're going to dig into all those lessons learned. Stick around, it's going to be a great conversation. Welcome, Avanlee. So you just got back from Wisconsin?
Yeah.
How was it?
Appleton, if you've ever been. I've never been. It was fun.
I've never been. You know, I grew up in Iowa, grew up in the Midwest. You grew up in Montana, right?
Yeah.
So how's Appleton? What's going on in Wisconsin?
Well, one of the health plans that we're getting ready to work with, they're based there. And so it's good. It's Wisconsin's largest health plan. So it's great. They actually they're a 5-star rated health plan. So they're just like, I love working with people who are innovative, and they're like, we want to remain number one. So how do we do that? We constantly need to be innovating and like what's best for the members. So that was great. Anyway, yeah.
That's awesome. Well, I wanted to follow up with this conversation because really you're in year 5 of Avanlee Care. You're on fire. You've hit a stride. You are accelerating both on your product as well as your kind of just your business, your customers, and you've really made incredible progress with these health plans. And I wanted to kind of get an update and share that with the world and hear from you. What's going on at Avanlee Care? What are the updates? What do we all need to know about?
Okay, what do we all need to know about? Well, we have some good news coming. I can't publicly announce it yet. We talked about it last time. It will be publicly announced soon, but we have made a lot of traction on the capital front, which is so great, which was a lot and based on what we have done historically with Startup Health, and interviewing with Logan and just updating on the company and how we had pivoted and going into Medicare Advantage. So that was exciting because that funding came from a call that we had an interview, and then they reached out to us and said, hey, we focus on gap closures in the market, and we see a huge opportunity between the health plan, the healthcare system as a whole, and the caregiving family to kind of bridge this gap and integrate these people in. And they ended up investing in the company, and I was even raising capital. So
that's amazing. Well, what I love about that story, first of all, it was your first venture investor, right? And it came to you. And what I love about the story you told me about last time is you just stopped fundraising and started just focusing exclusively on customer development and your product. And at that point, that's when the inbound investors started coming to you. It's such a I think, important lesson there for so many founders. What was that moment like? Would take us back,
Yeah.
because you've worked incredibly hard to get to that point, and then it all started clicking. What was that like?
Well, I was actually just on the phone with another startup health company that joined about 6 months ago, and kind of he was asking me the same question. They're in the first year of their business, and you know, I I for 4 years was raising capital all the time. And I always thought I maybe had like 3-month windows where I wasn't, and it was great. But in the first 4 to 5 years of your business, especially in the tech space, it's really hard to find product market fit. And it's challenging. One of the biggest challenges and why startups fail is finding the customer. And so for 4 years, it just felt like we were banging our head against the wall, and we would release a new version and a new feature. And then but in that, we got really great partnerships going with Walmart, integrating Walmart's OTC. We were their like kind of guinea pig with online pickup and delivery, their API. And so we got in there, we were able to get OTC grocery, and then met Mark Cuban, and we integrated cost plus drugs, and that API integration was like 3 days versus 15 months. So that was a little easier. And then we, tried to go to home health. We were in the consumer market, but then we really figured out what we were doing really well was leveraging adult children who are part of, mom who's has a Medicare Advantage plan, getting her to get to her annual wellness visit and get to her chronic condition appointments. And then also too, we were just killing it on the med adherence side. During COVID, caregivers were like, how do we all get together to make sure mom's getting her medications? What is she taking? Is it changing? And so those were really our bread and butter. And last summer, we just had like a board meeting in Montana. And on the 4th of July, that was the only time we could do it. And we all flew in and we just did an overhaul, and we decided we're going to become SOC 2 compliant. We wanted to get high trust and then build this product based on what we knew we did really well with health plans. And that just worked. But I stopped, to answer your question, I stopped in the fall of last year. I was like, I can't raise capital anymore. If I continue to raise capital and I do not focus on selling, this company is going to die. And that's kind of what I did. And our board was like, we have really strong investors, incredible backers. And they just said, we're going to bridge you during this season. During that time, so many companies in like 2023 and 2024 who were birthed in the 2019, 2020, they were dying. A lot of companies were going under. And, our board was like, you have to stay alive during this next 2-year window. And we did. I quit raising. We managed our cash really well. And I focused on health plans and Medicare Advantage plans. And then out of the blue, we did that interview last year about how we were working with these health plans. And then the VC out of New York reached out and said, this is brilliant. And they liked that we weren't a company that was 12 or 24 months old. They liked that we had kind of navigated the crazy chaos over the last 5 and 6 years of companies coming up and failing and coming up, and that we survived.
So you're at year 5 now?
Yeah, we're coming to year 5.
Such an inflection point, because you've really been through that roller coaster. You described the 2019 to 2020. I mean, those are really tough years to be fundraising, to be building. And there's so many things to unpack in what you said, because you focused on improving your product. You got the trust, SOC 2, you integrated with key premier brands. And then by focusing on your product and your customer, these health plans, that seems to be like a pivotal moment, kind of a game change moment. Can you publicly mention the health plans that you first started working with, or is that not public yet?
Not public yet, but really soon. The plans that I can talk about, and the plans that we really wanted to focus on were health plans that, so over the last year, what we learned was 60% of Medicare Advantage members rely on an informal caregiver as their key communicator with the health plan. And so as we began to speak to these health plans last year, some of the first questions that we're asking is, how are you formally communicating? And what we heard was, it's just somebody picking up the phone and calling them. And those notes are going in the EMR, just in the notes section, or they are basically written down in an Excel doc. And so they just said, we have no real formal way to communicate with these families and bring them in. And I think the frustration too, with even speaking with, one of the beautiful things was going B2C, was we worked with the adult children, and their biggest struggle was, we are just calling. All I'm doing is I'm on the phone with the provider and I'm on the phone with the health plan. And so when we were working with one of these health plans, this really brilliant woman just said, to have everything in Avanlee Care for the adult child who's already getting mom to her doctor's appointments, arranging the ride, wanting to communicate with us, but to have this as, I rely on everything for my mom in this solution, but also I can get to the health plan. It creates just this stickiness. It's not rocket science to bridge the gap of fractured communication. And so that was really what I wanted to accomplish when we started this company. I've always talked a lot about why we did this, but truly, solving such a simple problem sometimes leads downstream to some of the biggest changes and downstream effects in terms of ROI. And so, family caregivers provide $600 billion a year of unpaid work. And so, especially with the new administration, that's very uncertain what's going to happen with reimbursements and how health plans how much they're able to do with much less, is leverage the 54 million unpaid family caregivers to help with patient outcomes and better patient care, but also so the plan can have higher star ratings, higher CAP surveys. So it's
What
just
you're
been
it's like, what's resonating with the health plans? You mentioned you're helping them get the higher star ratings. Your product is simple. It's easy to integrate. What are some of those things that are now starting to click with health plans, and now they're coming to you, in fact?
Yeah. I think what's starting to click with health plans is, how do we basically do more with less? And they already have this relationship with these families with Medicare Advantage members. And there has been a lot of very top level leadership change saying, we need to have strategies around the caregiver and to bring them into the picture. And so that's what's really changed in the last year. And I think that COVID had a big part in that, because overnight as a country, it was like, am I going to use FaceTime? I can't use Zoom to see my mom. Do we just put all this as the family in the Excel doc? So it really helped us as we kind of came to market just at unique times and what was happening in the country.
Yeah, there was this, I remember very vividly, when even all the health systems who we had been trying to get to even use something as basic as telehealth,
Yeah.
it just went from 4% usage to 90+% usage overnight. So the whole culture was adopting this new kind of way of operating. So I think that's a really important point. Timing also matters here. So you are coming online and bringing a solution to market at just the right time, where the industry was ready for it.
Yeah. And I do think too that at the end of the day, people want to be at home for as long as possible. And we need to really, hospital systems, health plans, just the healthcare industry as a whole, we need to be like deploying products that allow people to age at home because it's much more affordable than going to long-term care facilities. And so I hope that, I was saying last time, when we look back in 10 years, well, it's the healthcare, so let's just say 10 years. It's not going to happen overnight. When we look back in 10 years, I really think that things need to be rewritten on how the healthcare system views the senior at home. It's the fastest growing group of people on the planet, people over the age of 65, and the unpaid family caregiver who is doing the work of essentially the paid caregiver. If we can integrate them into the ecosystem of health around aging adults in America, we could actually maybe change how healthcare really is delivered in the home, but also make it easier and better support the caregiver who's doing the care.
What I totally agree with that. Who needs to know about Avanlee Care today? You've got these amazing tailwinds where you've really established product market fit. You've got extraordinary investors. You've got an amazing board. You've got people like Esther Dyson as your chairman. You have a great partner, a co-founder. You've just been making all this progress on your product as well. And now there's inbound coming to you, and health plans are picking up the phone. And I know CEOs of big health plans, I won't name names, but they're telling their teams, hey, we want to learn about Avanlee Care. So there's this kind of moment you're in of real momentum. Who are you trying to reach, and who does the world, and what does this world need to know about Avanlee Care today?
So we are trying to reach health plans, Medicare Advantage plans. And specifically within those health plans, we are working with individuals who are in the stars and like kind of the quality and risk department. So looking at metrics around med management and adherence, that's a 3x weighted measure for a star rating for a health plan. Getting the annual wellness visits scheduled, the chronic condition appointments managed and scheduled, the CAP surveys. Anyone who within that health plan who is over strategy for member retention and satisfaction. One interesting thing about this is a lot of these caregivers are in an age range where they're soon also probably going to fall and needing getting on a Medicare Advantage plan. And so when you have a happy relationship with the member, you're getting better ratings, but then you also now have 2 or 3 adult children who have been using this platform and they have such a great experience with you. It kind of just like is a trickle up, I guess, effect, because we're aging, not going down, but up effect where they're maybe more likely to choose your health plan and when they get into that season. And so that's who we are actively working with, growing that team too within Avanlee Care. And then, in terms of investors in the world, raising capital has just been such an art and a dance. And I've learned that it's so different for everyone's journey is so different. I would say in the next 12 months, I'm probably going to be looking at doing a different type of financing round as we grow and scale with these health plans. And so I'm looking for investors, kind of like the one that came to us and why, it was a good thing to let them invest in this company is I'm looking for investors who are willing to support founders who really have not had the kind of like the traditional of like, I went to this school, I was able to raise in this amount of time. Like it's just can look at the company and say, look at how these people basically did absolutely nothing, made it this far. Yeah. And we want to bet on the team. And yeah. I am looking at more investors who look at the team and say they're worth making the bet on because they are going to take it to the finish line because they had to make it work in the early days. And so that's kind of the investor I'm looking for that sees the big vision of the problem that we're trying to solve.
I love that. I will never forget the first time I met you I think it was, I may have met you before, but I met you in person at the KOA campground in Billings.
Yeah.
I drove in with your amazing baby boy, Adam, and in your truck and Montana. And I bring this story up because you, as a CEO, extraordinary founder, building in Montana, but you understand something that I think a lot of CEOs and founders might not about this particular challenge, which is this is a vast country. There's a lot of people who might be hours away from access to their health system, to their food, to the grocery store, to the ability to get prescriptions. So this whole caregiver journey linking with the families and the patients and the systems and the health plans is one that you deeply understand from, I think, an extraordinary way. So when you look at your team and you look at the amazing team that you've built and the people like Esther Dyson who are backing you and also your co-founder on product, and you look at that whole team, it's such a unique composition that I think gives you an edge, if you will, to then what a customer like a Walmart or a Cost Plus partner or any of these health plans you mentioned, you're traveling around the country now meeting with new health plans who they have a whole market they're trying to serve, and you intuitively your team understands those needs in, I think, a really important way. So I think that's a secret edge that you have, quite honestly.
Yeah, thank you. I remember when we were talking about that, Esther's so funny because she has her Esterisms, and for a while, we're based out of Billings, Montana, and forever in the early days, especially when it was just hard to stay alive. Yeah, I was like, should we move our headquarters to New York? Like, will we be more attractive if we're out of New York? Like, and Esther just kept, I remember one day we were walking and she just was like, New York is a bubble. It's a bubble. But it's a big world outside of this bubble. And New York and Silicon Valley are great because, unfortunately, had I not left Montana during seasons of my life and gone back to New York City, we would not have gotten funded. And I've been told, and I don't know if this is totally true, I've been told that Avanlee Care is the first female-founded health tech company in Montana's history to ever get VC backing.
I'm so happy for you and so dismayed to hear that at the same time. Like, yeah. I think what Steve Case did with Rise of the Rest, I think what we've seen where they're the most amazing founders, leaders, CEOs all throughout this nation in places like all over Montana or Iowa, where I'm from, or throughout the country, as well as women-led companies. Yeah. You are a shining example of that. That is just a wow. I mean, yeah. I'm still reflecting on that. It's almost like the governor should be, backing you and making sure that this is a thriving, shining example of your state. And not only that, we need many, many more throughout the nation. But that's really cool, actually.
Yeah. Yeah. And, I know Greg really well, Gianforte, and his wife, Susan, and he did come to meet our team. He came and met Esther because I remember he was like, Esther, and he's a really serious guy. Like he's just a lot of emotion, but because he sold Right Now Technologies and Bozeman and Oracle bought it. And that's kind of what began the tech boom in Montana was what Greg did with Right Now. And then, he came to meet Esther and he has just been like, I'm very proud of you for what you're doing. And he also knows, just the challenges outside of starting this company that I've had to kind of go through while navigating this company and becoming new mom and then while doing a company. But it is something that I've talked a lot about with lots of people in Montana is, you know, it's just, it shouldn't be this challenging to get access to capital. And, the governor really wants people to stay here and they want them to start companies here. But, in Montana, unless you're in defense tech, beer, agriculture, oil and gas, most people looked at me like I had three eyes when I said, this is a healthcare technology company in the world of caregiving, family caregivers. I would say it's one of the largest, markets on the planet. It's the care economy. It's expected to surpass what the space industry is going to yield by 2035, according to the World Economic Forum. And just, this is so foreign to us. And so that's okay. We can start something different here. And I hope that this model, whatever happens with Avanlee Care, is replicated throughout lots of other states outside of New York and California, where sometimes women just understand problems better than men do, but like anything related to pregnancy, I bet a woman probably understands that a little bit better if they wanted to go start a company around that than maybe a man would. So there's just things that, we by nature do more, and by nature men do other things more and have more experience in that. But I do hope that over the coming years, we do see an uptick, but even to just VC in general, 2% of funding VC dollars goes to women, 2%.
We've got to change this. Calling all investors.
Yeah.
Starting with Avanlee here, Avanlee Christine, you need to meet Avanlee Care and their team, and we need to be backing more women-led companies and companies throughout the nation. I mean, as I mentioned before, you're a shining example. This is a smart business opportunity. You're an extraordinary company. They do have airports in Montana, and you just traveled to, you go back and forth between New York and the Bay Area, and you were just visiting a health plan in Wisconsin. And so I see it as almost an advantage that you're there. And it sounds like maybe Esther did too. What are some of the benefits of being in a place like Billings? I mean, I'm looking at the beautiful office you're in now. I imagine it's less expensive there than maybe in New York City if you had to rent an office space.
Yeah. So the benefits of Billings. So I want to separate this from Bozeman, because what's happening in Bozeman and Big Sky is just crazy since COVID. The cost of living there is astronomical, and it's really no different in terms of renting in Bozeman than renting in Manhattan. It's just crazy. So, we've stayed in Billings, and I like Billings. Billings is the biggest city in Montana. There's more of a healthcare kind of ecosystem out of Billings. But, my co-founder was from here. Our VP of engineering, Travis, was from Billings. And our other kind of fourth, I would say, more founding kind of team member too, Myra's from Billings. And, we've all kind of made the decision that we're going to stay headquartered here. It has allowed us as a startup, to keep the burn really low until we figured out where it is we were going to go. And we've been able to really attract talent. I think people want to move to Montana, and it's a little bit more affordable here. You can also still ski, you can go fly fishing, you can do all those fun things. It's just, it's not Bozeman where everyone is kind of flocking to right now. But I think people are starting to see that Montana's a pretty big state. There's a lot outside of Bozeman. But in terms of getting back to New York and the things that, I've had to do while being in New York City to keep this company funded, it was very important that, and probably is going to be for a while, that we have a presence in New York, because it's where the majority of our investors are and our board. And so, and also too, just the hustle and the bustle and what I've learned from working in New York City, what I've learned just in terms of raising capital, the connections I've made, my story one day, we'll share more with Esther, just what she has, she was the first person that took a bet on us, and it just changed our whole life. And then the relationship that we've had, and that's grown into, and just how she's just been just a role model and influence, but just an anchor and Adam in I's life. It
She's
just,
such an extraordinary. I think I mentioned the last time we talked, I met her 30 years ago, and she's just this amazing wisdom keeper and amazing partner. She was our very first angel investor at Startup Health 15 years ago, and just
yeah.
always shows up. She every time I meet with her, she wears the first T-shirt that we gave her with our logo on it. She's thoughtful, and it's just amazing. And I know she does that with other partners and companies and people. So I just love seeing that relationship that you all have, and
Yeah.
it's just so beautiful. And it's true because you're actually, I know you're in Billings, Montana now, but you're also really also a New York based because you spend a lot of your time there in New York as well. What's it like today? Are you flying around the country doing meetings? You have a young child,
Yeah.
beautiful Adam, who I absolutely adore. What's that part of your life like? It's such a extraordinary feat to be raising a family and also leading a company, building a company, all the things that you're doing. What are your biggest lessons learned? And maybe to other women founders out there or people who are thinking about it, what are some of the, obviously there's challenges to be aware of, but what are some of the positives? What are some of the things that you would say? There's probably 10 things you might say, hey, don't go do this
Yeah.
less, but maybe there's also some things, hey, here's why you should go do this. What are some of those things?
Yeah. So it's been very hard, you know, I, it's really hard to start a company. And then, it's like I had two children. I had Avonlea Care was birthed and we had raised our first round. And, you know, I've learned I'm going to be a mother, and that was really exciting. And the harder parts was that I was just going to have to probably navigate motherhood on my own, which is not something that I ever thought, I never thought that was how I was going to start a family. And so, but I remember, God, it's so hard to tell that story without crying, but I remember when I, went to Esther. I guess there was one of the first, I called my mom, and the first thing she says, "You're going to be a great mom." And then I remember I went over to Esther's apartment on 13th. I was in the 12th Street loft, 'cause she was letting me live there for free while I was trying to start this company. And it was raining. It was like a movie. It was raining, and I walked over there, and Esther's, that's shuffling around. And I just remember I told her, and I'll never forget this. I don't know if she remembers this, but she just like, didn't say anything to me. And she turned around, she like went and started doing her dishes. And I was like, what is she doing? And she just like, is she not going to say anything to me? And she turned around and she came back and she sat out cross-legged on the ground. And she just said, well, this is going to be really hard. You know that, right? I was like, yep. And she just said, but you just can't worry about, where you're going to live, and you don't need to worry about these things. And you just need to focus on the business and being a mom. And having investors like that and even my own mom, who just stopped working and became my son's primary caregiver so I could do this company still. To have investors and family like that, that is what carried me through the last 4 years of my life. And, many other things happened during that time, which there will be a time and a place to share the battle that I have walked out of in choosing my son and having to also navigate that with this company. There will be a time and a place for that. But I would just encourage women that, if you're going to start a company, or men or women, it has to be in your DNA. Like, I believe that this is what I am supposed to be doing because I see the problem we're solving. And I also believe that having Adam while doing this was such a great decision. And he's like the little co-pilot. The kid loves to travel. He's a great traveler. He's 3 now. Adam has met more famous people in his first 3 years of life, and he's going to look back one day on the things that he got to do with me while starting this company. And I hope one day he's like, wow, mom, that is so cool. Like, who are these people? But like, so cool that he gets to experience this with me. And Adam is just, yeah. So
I love that he gets to travel with you and do that. And I mean, you're just a superhero, and to have that gift even as a child and growing up, I mean, that's a gift for him as well, to be exposed to all these things. You see, hey, if Elon Musk can bring his kids into the Oval Office, you should get to bring your kids all over the
yeah.
world to these amazing meetings and conferences and things that you're doing.
Yeah.
Wow, just kudos to you. I really remember vividly you driving up in your pickup truck and me getting to hold Adam. I think he must have been a couple months old at that point.
Yeah.
And it was just, I love that feeling. And I instantly could see and feel, I was with Katya and my kids, and feel your power come in. And I just knew you are an amazing founder. You're an amazing CEO. You feel these things. So it's just so inspiring to see the progress that you keep making and where you are at this inflection point and how the business is really taking off. So this is awesome. I'd like to do a series of these conversations over time, and
Yeah.
I think, gosh, there's certainly a book, if not a movie, in your story as well. So maybe one day that becomes Avanlee 2 or something. But thank you for sharing this update, and we'll go from there.
But also too, thank you to Startup Health. Like we've, this was just becoming a startup health portfolio company, when we did not know what, we didn't really know what we were doing as a company, but you guys came in on the first round and that meant a lot. And then also too, because of the work we've done together and just the progress and the updates over time, it helped us land our first VC. So thank you.
I'm so happy to share. And I just know there's such growth and opportunity with what you're bringing into the world, and all the great plans. Definitely need to meet you. Great investors should be meeting you. You are a amazing team to bet on. So we'll do our part to spread the good word. So thank you, Avanlee.
Thanks, Unity.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.